After considering factors which have contributed to patient falls on the unit, the nurse manager realizes that they've had an increase in patient falls of 30% over the last 6 months. To better illustrate the factors which contribute to patient falls on her unit, the manager makes a fishbone diagram of increased fall rates. A fishbone diagram can be used to record events which contribute to a change in care, which might be for better or might be for worse. For the following diagram, we are looking for the factors which are making a change for the worse. Factors which were considered were people, equipment, medication, training, environment, and measurement. In this scenario, the people who were giving care to post-operative patients contributed to fall rates. There was a shortage of physical therapists available for post-operative patients. The nurses caring for these patients had all been hired as new grads in the last year, and many did not have the experience in how to ambulate patients during the post-operative period. In the equipment category, there was a shortage of walkers, gait belts, and wheelchairs, which made it difficult for even physical therapists to ambulate patients properly. A few of the bed alarms had also broken, and patients were getting out of bed without notifying staff. Medication was an issue because it was seen that there was an increased use of narcotic during the post-operative period, which are sometimes given with other medications which disrupt a patient's sense of balance and judgment. The category of training showed that the facility was behind on their in-service education experiences, and some of the new nurses never received a completed orientation to their unit. The environment was also found to have some issues. There was reports from patients that they did not feel comfortable making bathroom requests from some of the staff, who were always unfriendly to these patients. Additionally, the lighting was poor in most of the rooms, and the patients did not know how to turn on additional lighting. Lastly, due to the high acuity, there were many patient belongings on the floors where patients should have had a clear pathway. This was all measured by falls per month, severity of falls, the time of day of falls, and reason for falls.